Welcome to But Frankly Pierce News. I'm Arthur Fairview. Today I wish to approach things a bit differently.
He finally got the memo.
I have some history and an important question.
Well, get on with it.
Here's a brief timeline on the events of the pandemic that led us to where we are today. January 2020, the World Health Organization announces a mysterious coronavirus-related pneumonia in Wuhan, China. The CDC says 3 airports will begin screening for the coronavirus. A person returns home to Washington State from a trip to Wuhan, China, created the first case of COVID-19 in the US. The next day, Wuhan is placed under quarantine. The World Health Organization, or WHO, not the WHO, the WHO issues a global health emergency.
Right. We were wearing masks and social distancing at this point, right?
No. February, global air travel is restricted, and the U.S. declares a public health emergency. In a taped interview with journalist Bob Woodward on February 7th, failed former President Donald Trump, who was still in office at the time, told Woodward about the coronavirus.
It goes through air, Bob. That's always tougher than the touch. The touch, you don't have to touch things, right? But the air, you just breathe the air. That's how it's passed. And so that's a very tricky one. That's a very delicate one. It's also more deadly than your strenuous flus.
China's COVID-19 deaths exceed those of the SARS crisis, and the CDC says COVID-19 is heading towards pandemic status. On February 29th, the first U.S. death was announced in Seattle. It subsequently emerged that 2 other patients had died in California earlier that month.
Okay, so now we started with the masks and the social distancing, right?
No. March. 21 passengers on a Carnival cruise ship test positive for COVID-19. 21 of the 46 people were tested out of the 3,500 passengers and crew aboard. The ship was held at sea instead of being allowed to dock in San Francisco. The WHO, not the WHO, declare COVID-19 as a pandemic. Trump declares COVID-19 a national emergency, unlocking billions of dollars in federal funding to fight the disease spread, and a travel ban on non-U.S. citizens traveling from Europe goes into effect. By this time, the U.S. death total has surpassed 100, with cases confirmed in every state. The U.S. came to a standstill, schools are closed, links to the rest of the world drastically reduced. With the economy struggling on March 23rd, Trump said the country could not afford to continue the lockdowns.
America will again and soon be open for business, very soon, a lot sooner than 3 or 4 months that somebody was suggesting.
By late March, the death tolls were rising, the cases were growing, and the country was shut down. Thanks to the audio tape recording from Bob Woodward, the world has learned that Trump lied about the status of the pandemic. In an effort to save face, Trump admitted playing it down.
I wanted to always play it down. I still like playing it down.
Yes, sir.
Because I don't want to create a panic.
When asked why he would do this, instead of briefing the country on the information he had prior to February 7th, he responded,
We don't want to run around screaming, shouting, oh, look at this, look at this. We have to show leadership. And leadership is all about confidence. And confidence is confidence in our country.
April.
Now?
April 4th. The CDC recommends social distancing and wearing a cloth covering when going out in public.
Finally.
What took so long?
But stresses not to wear a medical face mask meant for healthcare workers due to the shortage. 2 days later, the U.S. reported the 3rd highest number of reported deaths from the virus in the world, with 10,000 dead. On April 24th, the U.S. hits a grim milestone of 50,000 deaths from COVID-19. May 27th, the U.S. recorded 100,000 coronavirus deaths, barely a month after passing the 50,000 dead milestone. June 11th, the U.S. passes 2 million confirmed cases. On July 1st, the European Union announces it will allow travelers from 14 countries outside the bloc to visit EU countries. The list does not include the U.S., as it is not considered a safe country. July 7th, the Trump administration notifies Congress and the UN that the U.S. is formally withdrawing from the WHO. On July 27th, the Moderna vaccine enters phase 3 testing. On August 13th, the former president changed his approach and endorsed masks in a confusing remark.
We have urged Americans to wear masks, and I emphasized this is a patriotic thing to do. Maybe they're great, and maybe they're just good, maybe they're not so good, but frankly, what do you have to lose?
By the end of August, the total number of coronavirus cases surged past 6 million mark, with states including Iowa, Minnesota, North Dakota, and South Dakota reporting daily records. At this time, more than 183,000 people had died from the disease. August 23rd, the FDA issues an emergency authorization for the use of convalescent plasma to treat COVID-19. And on August 27th, CDC notifies U.S. public health officials to prepare to distribute a potential COVID-19 vaccine as soon as late October. September 9th, then candidate Joe Biden called out Trump's lie and provided some key takeaways on this situation.
On the day that we hit 190,000 dead in the United States because of COVID-19, we just learned from the Washington Post columnist Bob Woodward that the President of the United States has admitted on tape in February he knew about COVID-19 that had passed through the air. He knew how deadly it was. It was much more deadly than the flu. He knew and purposely played it down. Worse, he lied to the American people. He knowingly and willingly lied about the threat it posed to the country for months. He had the information. He knew how dangerous it was. Now, while this deadly disease ripped through our nation, he failed to do his job on purpose. It was a life and death betrayal of the American people. Experts say that if he had acted just 1 week sooner, 36,000 people would have been saved. If he acted 2 weeks sooner, back in March, 54,000 lives would have been spared in March and April alone.
On September 22nd, the U.S. passed 200,000 deaths. On October 2nd, the White House reported that Donald Trump and his wife, Melania, had both contracted the virus. After 4 days of emergency treatment, Trump left the hospital on October 5th. By November 27th, the number of COVID-19 patients being treated in hospitals across the U.S. reached 90,000. The rate of hospitalizations was at the highest point since the pandemic began, pushing some medical facilities beyond their capacity, drawing alarm from public health experts and state officials. December 8th, President-elect Joe Biden promises to deliver 100 million doses of the vaccine in his first 100 days in office. December 10th, vaccine advisors to the FDA vote to recommend the agency grant emergency use authorization to the Pfizer vaccine. On December 14th, first doses of the vaccine were delivered to all 50 states, DC, Puerto Rico, and the first American received a COVID-19 vaccination. December 18th, the FDA authorizes the Moderna vaccine for emergency use. And on December 21st, then President-elect Joe Biden got his first vaccine dose on live television. January 20th, 2021, newly elected President Biden halts U.S. withdrawal from the WHO. February 22nd, 737,000 vaccines were administered while death toll from the COVID-19 exceeds 500,000 in the U.S. February 22nd, 737,000 vaccines were administered while the death toll from COVID-19 exceeds 500,000 in the U.S. On February 27th, the FDA grants emergency use authorization to the Johnson & Johnson vaccine.
Wow. You really did your homework.
Well done, you.
Each of these separate moments in the timeline show how the U.S., under the control of Donald Trump, dealt with the pandemic. Not only was Trump aware of how serious it was, he did not brief the American people and continued to play it down by not wearing a mask, hosting social gatherings and rallies that became super spreader events. Did he do the right thing to handle the pandemic? Did he act soon enough? Would we have lost as many people to the virus if greater communication to the public of the seriousness of the pandemic and proper safety actions or precautions were taken? In an interview on CNN this past Sunday, Dr. Deborah Birx, the former administration's coronavirus response coordinator, very plainly laid it out what we already knew. The Trump administration's pandemic response was riddled with dysfunction, and the discord, untruths, and infighting most likely cost many lives.
There were about 100,000 deaths that came from that original surge. All of the rest of them, in my mind, could have been mitigated or decreased substantially.
So what does this mean?
I don't know. Why are you asking us?
Yeah, you seem to have all the answers.
Let me sum it up for you. In that interview with Bob Woodward back on February 7th, Trump said the virus was more deadly than your most strenuous flu. Yet he did nothing. On February 26th, at a public news briefing, he again dismissed the threat.
And again, when you have 15 people, and the 15 within a couple of days is going to be down to close to zero, that's a pretty good job we've done.
February 27th, Trump uttered this famous quote.
It's going to disappear. One day it's like a miracle. It will disappear. And from our shores, it could get worse before it gets better. It could maybe go away. We'll see what happens. Nobody really knows.
When the first U.S. death was announced in February, Trump told reporters the deceased person was a medically high-risk woman in her late 50s. A health official in Washington stated later, it was a man.
That ain't no woman. It's a man.
Roughly 1 month after failed former President Trump knew about the virus, he downplayed it again with his usual baffling logic.
Now, I guess we're at 26 deaths. And if you look at the flu for this year, we're at 8 million. We're looking at 8,000 deaths. And, hundreds of thousands of cases, but we have 8,000 deaths. So you have 8,000 versus 26 deaths at this time.
So what's your point?
Here's the point.
Finally.
Can we, the people, sue the former administration in a mass wrongful death lawsuit? But frankly, Pierce News asked our legal expert and attorney about this. Thank you for taking time today to join us.
My pleasure. Thanks for having me.
Tell me, Anna, what is a wrongful death lawsuit?
Well, the term is actually called an action, not a suit. But by legal definition, wrongful death is the death of a human being as the result of a wrongful act of another person. Such wrongful acts include negligence, an intentional attack such as an assault and/or battery, a death in the course of another crime, vehicular manslaughter, manslaughter, or murder. Wrongful death is the basis for a lawsuit against the party or parties who caused the death filed on behalf of the members of the family who have lost the company and support of the deceased. So, a child might be entitled to compensation for the personal loss of a father, as well as the amount of financial support the child would have received from the now dead parent while a minor. A wife would recover damages for the loss of her husband's love and companionship and a lifetime of expected support, while a parent would be limited to damages for loss of companionship, but not support. A lawsuit for wrongful death may be filed by the executor or administrator of the estate of the deceased or by the individual beneficiaries.
So based on negligence alone, with the evidence we have laid out, could failed former President Donald Trump or the Trump administration become part of a large class action based on wrongful death in their handling of the pandemic?
I think it has merit and would be worth looking into.
An attorney, our but frankly Pierce News legal consultant. Thank you, Anna.
Thank you.
So based on that legal definition, I believe a case can be made that the Trump administration and failed former President Donald Trump himself were both intentional and negligent in their handling of the pandemic, and as a result, the deaths caused by COVID-19 virus. They were intentional in the following ways. They were intentional in withholding vital information about the seriousness of the coronavirus that Trump was clearly briefed on. They were intentional in ignoring and balking at proper safety guidelines and protocols instead of encouraging their use to the American people. Most notably, making fun of Joe Biden, who followed the protocols and wore a face mask. The administration under the leadership of the aforementioned failed former president was negligent in the following ways: rarely being seen using masks or engaging in social distancing protocols. The one exception was on July 12th when visiting Walter Reed Hospital. Dismissing the need while encouraging and flaunting his lack of use of masks and social distancing.
So I just don't want to wear one myself. It's a recommendation. They recommend it. I'm feeling good. I just don't want to be I don't know, somehow sitting in the Oval Office behind that beautiful Resolute desk, the great Resolute desk. I think wearing a face mask as I greet presidents, prime ministers, dictators, kings, queens, I don't know, somehow I don't see it for myself. I
They promoted and encouraged social activities in 2020 that led to super spreader events, such as the rallies held in North Charleston, South Carolina on February 28th, Charlotte, North Carolina on March 2nd, the poorly attended rally in Tulsa, Oklahoma on June 20th, and the infamous Rose Garden super spreader event that led to 50 cases of reported COVID-19 infections, including Trump himself. So if you or a loved one lost a friend or a family member due to this pandemic and the way it was handled, talk to an attorney. This has been But Frankly Pierce News. Thank you for watching. I'm Arthur Fairview, and I am not a non-attorney spokesman. I'm not an attorney either.
And